look better.
So smile.
Dallas.
You look so much better when you
New
You
Orleans.
look so much better when you
Come on.
You
Cleveland.
look so much better when you You
Detroit.
look so much better when you
Yeah. Philly.
So much better when you
Jersey.
So much better when you
LA.
So much better when you
All my people say.
You look so much better when you smile.
See, I just don't want you to be happy. Cause then you gotta have something happen then. I want you to have joy. Cause can't nobody take that from you. I see you. Smile.
It's a beautiful Monday to wear a big smile on your face, regardless of the economic situation we're bedeviled with. I understand. But the least you could do is smile. I mean, it's a holiday for some people who are not working. I think it gives you an opportunity to smile because not everybody likes to go to work. So wear a big smile if you're not doing so this morning. Welcome to Solutions Clinic, where we get to talk about everything and anything health. I hope you had a swell weekend, and I hope you are enjoying the festivities, particularly to our Muslim faithful. Do we, doctor? Well, we're enjoying with them either ways. And yesterday, I think the festivity is general because yesterday was Father's Day celebration, and I would like to think that fathers were celebrated. At least from my very end, I celebrated the men and fathers in my life, and I believe you were celebrated too, Doc.
I was.
Good. Love to hear it. And that's why this morning we're going to be talking about, a health concern that is pretty much related to men. I mean, women come down with it, but the prevalence is more with men.
Yes.
We're talking about stroke this morning. By way of introduction, a stroke occurs when the blood flow to a part of the brain is interrupted or reduced, depriving brain tissues of the oxygen and nutrients it needs. Within minutes, the brain cells begin to die, which can lead to severe disability or even death if not treated promptly. According to the WHO, strokes are the second leading cause of death globally, the third leading cause of disability, and a major cause of dementia and depression, very particular to men. Annually, 18 million people come down with stroke, and more than 5 million people die from it. Stroke occurs with children with sickle cell diseases as well. However, recognizing the symptoms and seeking immediate medical attention can significantly improve the outcome. And this morning, joining me to have this conversation is Dr. Chukwuma Okoli. Once again, good morning to you, Doc.
Good morning.
All right. So let's start off with how I can identify that there's a potential stroke in a person.
Thank you. Well, many people are aware about stroke and what it typifies. It's simply a disability, an inability to move as one would want to. So let me just break it down in simple terms. If you noticed that you are not able to move a part of your body, most times those who, we have different types of stroke, but we're not in the medical field. So we have hemorrhagic, we have ischemic, but that's not what we're talking about. Most people wake up in the morning and realize that one hand, one leg is heavy. They're not able to move it. It could even be just one hand or just one leg or both legs. Either way, you notice that there's weakness or probably not even being able to move at all or not even able to feel any sensation. Meaning, if someone touches you on that part of the body, you don't even know someone is touching you. That could mean a stroke has occurred. If there is weakness, it could be in evolution. There is something called transient ischemic attack. That is when the blood pressure of an individual shoots up and suddenly the brain trips off. Just like when you have high voltage and then circuit breakers trip off and then light goes and something. That could be a prelude. So we usually could say that could be stroke in evolution. In evolution means upcoming. So that's just trying to pick the slight things and the light words that people can relate with. And it's common, of course, in the old age. Well, but when you say old age, we've seen stroke in 35 years. Yes, so it doesn't mean I once managed a young man who's not even up to 30, and he was presenting with blood pressures of 200, 220, and at the end of the day, he couldn't move his arms and legs. We knew that was hemiplegia, hemiparesis, or paraplegia, paraparesis. So things like this, you need to be at alert. Now, the commonest cause of stroke in this environment is high blood pressure. Though we've seen cases of substance abuse, we've seen, like you mentioned, in the young, stroke in the young. That is when, for instance, in sickle cell, when the blood cells sickle, when they sickle, they form a cluster and they form a plug, and they can block blood flow to the brain, and that will also cause stroke, because stroke comes by the brain not getting adequate blood supply. Either the blood vessel, the pipe taking the blood to the brain, has busted, or due to pressure, the pipe now kinks, means it shrinks and then reduces flow. So either of these two ways, then blood flow eventually drops, and then stroke can occur. So in a nutshell, that's the commonest. We also have other ailments like diabetes and dyslipidemias, in situations whereby there's excessive lipids or fat in the bloodstream, which can cluster and form a clot and block. So either way, it's either the blood flow, the blood flow doesn't get to where it should. It's either it is blocked by an item physically causing an obstruction, or the blood vessel has broken or busted, and blood is wasting away in the surrounding and doesn't eventually get to
The brain.
where it's going, which is the brain, and that's the commonest way stroke do occur.
But are there early telltale signs as opposed to what you've mentioned? Can I see something that easily informs me? You mentioned the swelling or the heaviness of a side of a hand,
or not even
or
able to
a part of a
move.
body.
Yes.
Are they not the severe symptoms? Are there
No, those are lighter symptoms.
Lighter
because
symptoms,
the
okay.
severe ones are the fact that you see some people walking, you see them dragging a part of the body. For those, it has occurred already.
Oh wow.
Yes, you see some men walking and they are dragging a part of their body. Some will even use walking stick, and then you still see them twisting their leg. It's called circumduction gait. That one, stroke has occurred. So I'm talking about things that you can see now and say, this thing is about to. Like those that will suddenly, you say they fainted, they fell, they slumped or something, and then they quickly were revived and they are fine again. That could actually be a transient ischemic attack. Transient, short time. Ischemic means there is a blockage, so blood is not flowing beyond a particular point, and it's an attack because it comes all of a sudden. So that is it. And those are things that could tell you as a medical practitioner, check this blood pressure, this guy could have stroke if nothing is done from there.
At that stage, is it redeemable?
Obviously, yes, it is. TIAs are redeemable, 100%.
Fair enough.
The point is for those that have that good attitude to seek health. Some people will say, I'm fine. See, this statement annoys me with men. I'm okay, there's nothing wrong with me. Who says? Who says? I see that as a sense of irresponsibility coming from them. Because if anything should happen to them, they will put their dependents in jeopardy. So you have to be responsible. You have to take charge of your own life because you have people. Otherwise, leave them. Why are you having children if you can't take care of them? Why are you bringing forth people? Why are you taking people under your fold if you can't take care of them? So you know, since you took them in your fold, you owe them that to be healthy. You owe them. So take care of yourself so that you'll be able to do your job. If my parents did not do their own, will I be here? I won't. So all this, I'm okay, there's nothing wrong with me. That's rubbish talk. Go and check your blood pressure. If you're listening now, do two things for me, and then you continue the program. One, check your BP. Two, drink water. Thank you.
The very essence of this conversation is to make sure that men prioritize their health as we celebrate Father's Day. Because we want to celebrate the living men, right? It's not dead. And that's the essence of this very conversation. So pay attention, to what Doc is saying this morning. You've mentioned hypertension, which is a modifiable risk factor.
Exactly.
Now let's talk about, other modifiable and non-modifiable risk factors relating to strokes.
Yes, I mentioned diabetes, which is a modifiable risk factor, and then I mentioned dyslipidemias. Modifiable means whatever the situation is, they can be managed,
controlled,
they can be treated, they can be changed via medications. Now, the non-modifiable risk factors are the fact that we are black. You can't modify that. We are men. You can't modify that.
Right.
Yes. And then other modifiable risk factors, stress, and then yes, stress, whether emotional or physical or mental, you can modify all that. Like somebody will say, nobody can drive you crazy unless you give them the keys. If you only permit them to. And that's why if you're listening today and then there's somebody in your life stressing you out, you allowed it. The day you decide I am done with allowing this person, take your life back and walk away. Thank you. Let's continue.
Can you actually, in most cases, that would be difficult, especially when, love is in the equation. When love is in the equation, that's quite. But I mean, you have to do what is important to you. So if your health is important, then you would have to take that decision.
All right.
As much as it may look difficult. So how long does it take for one to, you're down with stroke? How long does it take to recover from it?
Okay, now let me approach that question from, you're not yet down with stroke.
Okay.
It is better imagined than experienced.
Right.
So do yourself this favor, do a checkup. Going to the hospital doesn't mean you are sick. It only means you want to stay more healthier. So do yourself that good. Take care of yourself. And if you are down already, the Lord is your strength. It could be managed for a lifetime. It depends on how serious it is. I have a loved one who suffered it for about 12 years. And
Wow.
yes, and she's out now, being able to move, now moving without support. I remember when it was walking stick, from frame to walking stick, or walking stick to braces, now completely off, and we are all happy. Now, it took those long distance of constantly watching over this person, constantly hospital, and what the doctor say, okay, what are we using? Okay, this drug, we increase it, we reduce it, all hands on the deck. Clinic compliance, drug compliance, and then lifestyle modification. It takes a lot of hard work. And then the physiotherapy, the part of trying to bring that part of the body back to life. So that's why I said, let me start by saying, if you haven't, please don't. And if you have, the Lord is your strength. Unfortunately, some do have this without any prior prompting. Yes, without any prior prompting. All these symptoms we talked about, some people never experienced it. Imagine somebody woke up and then having a conversation and next thing fell, and probably after a month woke up and realized the part of the body is gone. At that point, you're now saying, oh, thank God he or she even survived it. Now we are trying to manage life. I mean, recently my church held a program, and during the program, a pastor walked in and the whole crowd roared. We were all, very, very happy. Because this same man, who is a big man in the academic sector, suddenly slumped while preaching.
Wow.
Yeah, slumped while preaching. And for months of care, managing stroke, managing all those things. And on that day, he walked in without support. Walked in flamboyantly. We were all overjoyed.
Miracle.
Yes. So it takes a lot to manage stroke. So it is best prevented. But if it has happened, you will have to manage it. I told you about somebody who's 12 years down the drain trying to get herself back. And today she is, and much to our joy and thanking God for everything. So really, for people that have it, they need the family to stand with them. Yes, the support, follow them to the clinic, make sure they use their drugs, call them regularly, visit them regularly, make them happy, help them to feel good about themselves, avoid using words. Please, at this juncture, I was at a program on Saturday, and the pastor was talking about nowadays parents work for their children, while in those days it is children working for the parents. Please, if you're a child today, well, child meaning at least you have a parent, of course, and you are fond of saying rubbish words or rude words to your parents, take time. This is me telling you this morning, take time from the bottom of my heart. Don't talk to your parents rudely, no matter what. They gave birth to you. You suckled your mother's breast. Be careful. Take time. If you continue like this, you won't live long. Go and read your Bible. I'm not cursing. I'm telling you what the Bible says. So please, if you have parents, please, if you can't make them feel good, don't make them feel bad. Rather just stay quiet. Then when you want to talk, you start, it baffles me when you hear men or women speaking ill of their parents, blaming them for useless things. Come on. I mean, for whatever it takes, these are your parents. Give them that regard. Yes, we all make errors, we all make mistakes, but then
True.
we're humans, but we put them in their place. They are your parents, and give them their respect. And the fact that you make them feel good will play a lot of role in helping them recover.
Totally agree with that. I mean, there's a lot that needs to be said regarding respect and regard for parents in this generation of ours. And I hope that we apply caution, because someday you're also going to become parent. Then you understand what it feels like being in the shoes of the people that you speak against right now. Let's now talk about, I had stroke. I recovered. And there's stroke again. What happened?
It's better talked about than experienced. Now, we've seen people who had it twice. I have been privileged to manage a woman who had it 3 times.
Wow.
Yes, and that's a very rare privilege. She had it the first. I didn't manage her the first. I managed the second time, and I managed the third time. In fact, after the second time, I think she was now in the care of another sibling, another child, not the one that knows me. So that one didn't really understand all the warnings I gave about how Mama should have been managed until when she had it the third time. That one started moving her up and down town until when the sibling that brought her to me the second time got to know about it. I was like, at this juncture, I'm taking her back to the doctor who managed. And it was difficult. In fact, controlling the BP was Herculean task. It was difficult. That's just all I can say. It was difficult. But at the end of the day, we managed and she made it. And she still lived for about 3 years before she eventually passed. Yeah.
Wow.
Yes. But she managed, because by the third time, she was completely unconscious. And I remember she was on my bed for about 2 weeks. We didn't know if she was going to wake up. She had multiple convulsions. Yes, we almost gave up on her. I just had this faith, like, against all odds, like, at the end of the day, something will shall happen and she will be fine. And, against all odds, she woke up to the point of even recognizing me.
Wow.
Yes, I was grateful to God that everything went the way I wanted it to go, and she's fine. And then she now lived for like, I think 3 or less than 3 years before she eventually, passed to glory. So managing stroke can be a Herculean task for physicians. We always pray and we always tell our patients to, take heed to the instructions we're giving them to avoid a second recurrence. Because, like I said, this one survived the third one. It was just God. I know, because I'm a Christian, I always would say that it was just God. A lot of people do die by the second stroke. A lot.
What happened in that space? You've spoken about management. You've emphasized on managing stroke.
Yes.
Was it the blood pressure that resulted into
I said it in the beginning that that's the commonest cause. Yeah, most times it always has been. Though at times, in managing these people, you want to check all aspects. You check for their cholesterol and every other thing concerned. Yeah, most time, in fact, for that woman, she had this. I don't know. The cholesterol just shoots up as much as 370, and you're like, this thing shouldn't be more than 200, and you're having 370. That's gone in for a double. So you have to manage. And unfortunately, most of the medications to manage cholesterol are tablets. How would you administer this to somebody who has stroke? You might need to do a lot of adjustment and try to formulate things and find a way to get it in to the system so it will do the job. So, like I said, it's not always an easy task. It's not a walk in the park. It takes a lot of dedication. Even after discharging them, you might need to do some home visits and treatment and management, and then you get in a physiotherapist. A lot of things are involved. A lot of time is needed, and a lot of money is involved. So it's holistic, and it is long in duration. So you really have to keep at it. You must have the zeal and passion to take care of them if you want to see that success.
Fair enough. You mentioned something on drugs, and I want to bring some misconceptions that I've heard about stroke. The common one I've heard, which I would need clarity on, is patient with stroke should not take injection. And now you've mentioned, drugs. So because I know more often than not, you find that injections are substitutes for drugs.
Yes.
So is that a fact?
No, it's not true. Now, this is it. we in the medical field, we only defer the injections. What's the reason? Most people will see stroke taking out a part of the body, mostly the legs. So a leg that is just recovering, you now want to go sticking your how many
Needle.
centimeter long needle into it. And we live in a part of the world where people associate things with themselves. Like Yorubas would say, the witch cried yesterday, the child died today. They said it was the witch that killed the child. So you imagine you injected the person, and then tomorrow she now says that she can't move the leg. They'll say it is injection you gave that caused it. That's the kind of world we live in. So the health practitioners will now shy away from giving injectables, and that's why we thank God that, for instance, if you're going to treat malaria now, we have the intravenous. So you shy away from giving the intramuscular and rather give intravenous and oral. And if the person can't take oral, you just deal with the intravenous alone. We have like 2 medications that are given through the vein that are anti-malarials and are highly effective. So they are just misconceptions. It's just that we shy away from it because of all these misconceptions. So we don't even want to attempt giving the intramuscular because we don't want to start explaining what is not even looking physical or looking realistic to the medical field. Exactly. That's the reason why we shy away from it. Not that the injection will not produce any stroke. Injections don't produce stroke.
I mean, if you want to judge it logically, you might want to understand the perspective of people saying, injecting. So I get.
I do. So now, just to save me from unnecessarily explaining myself.
Because if anything happened and they hold you accountable, it was the injection that.
Exactly. That's why I feel just let them be. Give other routes. Thank God. You see, that's why I appreciate medical training. One of the things we're taught is route of drug administration. At the very early stage of our practice, of our learning in medical school, we were taught these things, and that's why I always cherish teachers. If you're a teacher listening to me, God bless you. You guys made us what we are. Yes, now my teachers took time to explain route of drug administration. Another one is rationale use. Like, how do you imagine, how do you want to administer? Why do you give what you are giving? So you would know everything. So if you administer a drug, okay, you have to think holistic. How would this drug affect this patient? Will it be beneficial? Will it create unnecessary fear and scaring and all that? I've had patients tell me I was scaring them. And I'm like, as much as I even explain, I try to be very plain and truthful. You still see that as me scaring you. Okay. If I'm scaring you with this, I don't know what any doctor wants to tell you, because I like to break down my information.
Right.
So you see people coming to you, they already have things in their mind, and then you're talking the next thing, they are picking it in the other way around. So at that point, it's best to just say, suit yourself.
But are there other misconceptions that you've heard with stroke?
Oh, it's basically from medications. I've had people tell me it is one drug. Even it's not necessarily injectable now. They tell me it is one drug. Like, people will come to me and say, "Doctor, you gave me these medications. You see, I used to feel somehow, and I think it's this one." Imagine, for instance, you take a drug and you feel headache. I know the BP drug that will cause headache.
Yeah.
And then you now start telling me another one, I'll look at it. Well, headache is a symptom that can come from anything. But once I see that particular medication I know that will cause headache, I'll just look at you and say, I don't think it's this. I think it is. No, this one is not cause. How did you know? I use them separately. You have to listen to them. Some of them have their points. Some will decide, let me use those drugs one by one. Like today in the morning, I'll use this one. And then tomorrow I'll use it. So when they tell you they are sure about them, you have to just follow. Okay, no problem. You change it. And then reassure them. And that's why sometimes your patients will tell you they're feeling headache. This one I want to say that. Let me just say it in a funny way. They'll tell you they're feeling headache. You give them medication. After 2 hours, they tell you the headache has come back again. You give them. After 2 hours, they come again. The headache. Just withdraw, just water to flush the vein and push it in and tell you, thank you, I feel better.
Well, that's strategic, because even you're dealing with different kinds of people, so you have to adopt different approaches to that.
Exactly.
That makes a lot of sense. Anyway, you're listening to Solutions Clinic this morning on the Remedy Dial, Solutions 93.9 FM, and we're talking about stroke. I have with me in the studio Dr. Chukwuma Okoli, and he's been lending credence to the questions that I have raised, from my research regarding this topic today. Remember, I did mention that the conversation is centered particularly to fathers as we commemorate the international or the globally celebrated Father's Day that happened yesterday. So if you have a question regarding stroke, do well to send me a message or call into the studio with 0909 888 9939 or 0912 222 2939. 0912 222 2939. So my next question, Doc, would be, are stroke genetically transferred? If it's a part of your gene, your parents, your dad, mom had it, is there a possibility of you coming down with it as their offspring?
Okay, thank you. They are not genetically transferred. It's just that whatever disease condition that could be inherited, for instance, sickle cell, and if it had led to stroke in someone in the family, can lead to stroke in another person in the family, exactly. But not like stroke itself being genetically transferred. It's just that if there's a disease condition that runs, like hypertension, yes, if a family sibling A had hypertension and had stroke from it, sibling B should be careful if the sibling has hypertension, because if care is not taken, he or she too can have stroke, just like the sibling A had. Exactly. So it's the disease condition that could be genetically transferred. And if such disease condition has a capability of causing stroke, then it can cause it in multiple persons in the same family.
Okay.
So and that's why I used to say, if we diagnose anybody with any ailment that we know is inherited genetically, we do contact tracing any member of the family that has this, so that you can inform them to be aware. Now that you are on medication, pass this message across. Most families have WhatsApp groups now.
Yes.
So this is not a time to say you want to keep whatever you're going through to yourself, or for what. Okay, even if you don't want to tell them you are going through it, just post a message. Everybody check your BP, kind of. They may want to ask you, Lagbaja, what is it? Are you okay? Well, I said check your BP. I did not ask you. Go and check it first. Exactly. Go check it first. You are helping them to be aware more about their health. That's it.
That makes sense. Now let's talk about, because I know that this is, a major concern for people who are caregivers to patients dealing with stroke.
Yeah.
How do you care for? Because I cannot even imagine that situation.
Yes, they gave me back the memory.
How do you care for someone who has stroke?
Thank you. Stroke, just like every other chronically ill persons, they need your patience, they need your good words, positive words. You can imagine waking up and then you enter the room and you're like, hey, daddy or mommy, whoever it is, you look good this morning. And possibly that person had woken up and is saying, how long am I going to be like this? And then you come like, you look good. Yes, you look good. But I've not been able to move my body. Which one? Which body you just moved? Now you just moved it a little bit. I moved it. Yes, you moved it. And they start believing. So I can. Yes, you can. They need your good words. It can be exhausting, I know. The worst part is when you're trying to feed them and they suddenly just take their mouth away. Like, they don't want to. Someone won't tell you, leave me, let me die. You'll be like, Oh, and then you go like, you're not even grateful that I'm giving my time. That's the part that I hate the most. Start talking about, am I the only child that you have? But I'm the one that left my job and sat with you. I managed a woman that, she had quite a number of daughters, but 3 of them were constantly coming around. One was particularly sleeping like 24/7 with her, I mean, other people will always have 1 or 2 variables in their family. So how do you manage them? Stay good with them. Be positive with them. Encourage them. Imagine I watched a woman feeding her mom and she was like, Mommy, I like the shape of your mouth. And the woman was trying to swallow the pap. Eventually she was like, what about the shape of my mouth? Do you want to kiss me? Mommy, can't I kiss you? And pam, she just kissed her mom. And the mom was like, you kissed me. Am I that attractive? Tears were in my eyes. I actually left the room because I was almost breaking down with tears. Like, that speaks a lot. And the lady started eulogizing the mom. That was when I left the room. Because I could just imagine, like, see love.
Empathy.
So it takes a lot. It takes a lot of sacrifice, a lot of patience, a lot of money, a lot of everything. Just stick with them. And the truth is, for those of you who are sticking with them, you will laugh with them. Yes, they will recover, and the blessings will be all yours. I pray.
Amen. The Lord is your strength, actually, if you're, having to deal with someone that is down with stroke. It's a lot. I've seen from movies. I've not had first-hand experience, and I can tell you for free that it's not a good sight to even behold just watching it, let alone someone who is, currently in that situation. I have a question here. Good morning, Doc. Are strokes and seizures related? This is Atere.
Okay. Strokes and seizures, the only relation between them is that when stroke occurs, like you rightly said in the introduction, a part of the brain is damaged. Yes, that can now produce seizures as a complication of stroke. Yes, it can produce seizures, yes. So that's the relation between them. Not that not that they are together, they are not. People can have seizures separately and not have stroke. People can have stroke and not have seizures. But certain parts of the brain may now be damaged, causing the person to have seizures.
But which is more impactful? Does seizure lead to stroke?
Exactly. Seizure does not lead to stroke.
Okay.
Yes, seizure is just like muscles firing excessively, and then it's jacking after a while it will stop. It hasn't led to stroke and will not lead to stroke. So it's not that when somebody is having seizure, you say, let's manage you. I don't want him to have stroke. No, they're not related. Seizure will not cause stroke. It is high blood pressure that will cause stroke. Okay, it's diabetes that will cause stroke. It is dyslipidemias that will cause stroke. So the things that will cause stroke are there. Seizures are not part of them.
Okay.
Yeah.
Fair enough. I don't know who sent in this, but I think I said it already. Does it only occur in men? Stroke.
Oh, of course, you see. Thank God you said it. Yeah, it doesn't only occur in men. It's 2 to 1 actually. Like we have twice the number of men.
Yes.
And just like I said on Saturday, you see, one of the things I'm angry with men for is that we don't take care of ourselves. We don't. Don't worry. There's nothing wrong with me. I'm fine. Those words are the words I hate the most. Who told you are fine? I had to tell some guy, I said, shut up your mouth. Who told you are fine? I am the one to tell you are fine. And if I have not told you you're fine, you have no right to tell yourself you're fine. So go check yourself before you say you're fine. Have you checked your BP? I started asking people, and then I was impressed. In fact, that meeting, we had the elderly people that were like, I could see like in their 70s and late 60s, probably a few in their early 50s, and then the ones in their 40s and 30s. So it had a set of the various ages of men's group. And then I was asking about people checking their blood pressure, and I was quite happy with the responses I got in that place. I could tell that they have good attitude to help. If you have nothing doing, check your BP. Just check it. Like I told you at the beginning of this program, do 2 things. Number 1, check your BP. Number 2, drink water. So after this program, if you haven't checked, please, it's holiday. There will be some pharmacies open. Just look for anyone in your neighborhood. Go there and check the BP. But before you go checking the BP, just grab a bottle of water and then, gargle it as you are going, drink it. And then before you get back home, make sure you finish that bottle of water. So it's good.
Drink water. Yes. That's the message.
Yes.
Mr. Kumi says, good morning to you, Doc. Interesting conversation in the studio. My question is regarding the complications of stroke if not early presented.
We talked about it.
But I think at the intro I mentioned something around depression, dementia.
Yes, they're all complications. And then the seizure that I mentioned, in few people, they may now have seizures. And then, of course, the part that is quite touching is the dementia and the depression that comes with it. Waking up and then seeing that you used to take a walk, and probably you managed to find your way to the balcony and you see people taking walks and you can't. Why? Because that person had suffered stroke, and that feeling of sadness steps in, and then from depression, they could just die. Yeah, because the immune system goes down with depression. They don't eat, they're unkempt, and things can just go south, can really go bad. So that's why I said, when you're managing a stroke patient, be careful the words. If you have nothing good to say, don't say anything bad. Just leave them the way they are and let them just be. Let them just be.
All right, this is from Adams. It looks like hypertension is the cause of every disease in this world. I mean, I think that for most conversations that we've had, hypertension always finds a way to creep into the conversation. What is the cause? We've talked about this on subsequent, but for the purpose of emphasis, he's asking what is the cause of hypertension. We've addressed this over and over again, but
Yes.
like we've stated, we can't overemphasize,
Yes.
a subject
Stress,
like that.
Yes, physical stress, emotional stress, stress basically. So wherever it is, financial stress. Well, I saw the message strolling on the TV when Tinubu was addressing and talking about your sacrifices as Nigerian. Please
Right.
leave our sacrifices alone. Leave our sacrifices alone. Do something about the nation.
Right.
Which one is telling us our sacrifices? What has the sacrifices done? People are dying on a daily basis because they don't even have money to treat themselves in hospitals. And then you're talking about sacrifices. How long are we going to continue like this? And then the next thing we hear that you released $1 billion for one program or something. And please, when people can't feed, so there are a lot of stressors in the environment that is causing. And then for a man, you are the one who is meant to provide for everything. You are the breadwinner of the house. As you are winning those bread, make sure that you take your time to take care of yourself. It's not about going out to win bread. You will always win. You're a winner. To God be the glory. But you need the energy to win. You need the good health to win. You need to drink water to win.
Right. Well, with that, it's a wrap on Solutions Clinic this morning. Dear fathers, dear men, dear boys,
Yes.
make your health a priority today.
Yes.
You owe it to yourself. Nobody will do it for you.
Thank you.
Just as women are very much intentional about health,
Yes.
you find that most, when you go to the hospital, you find most women in the hospital as opposed
I
to
attended
men.
to someone before I came. I was just, I don't know why, just her attitude made me happy. She stepped in and said she just wanted to check herself. And I ran a scan and everything was intact. I asked her, do you want children? She said, no, she's had enough. She just wanted to check herself. No cyst, no fibroid, no nothing. I was just happy, like, come on. And you came all the way from Ring Road to Akobo to check yourself. I was happy. Like, this is the right attitude we are talking about.
To health.
And the men are there reading newspaper with lipid, high cholesterol in their body system. And the next thing they will tell you is, don't worry, I'm fine. There's nothing wrong with me.
Newspaper
Says
that will
who?
lead to VP.
I don't understand. And then you read newspaper and then you will see things that will push your BP up. And you're managing it.
goodness.
God, come on.
Then let's do better.
Thank you.
Thank you so much, Dr. Chukwuma Okoli, for such great insight this morning. I'll be back next week, Monday, for yet another interesting subject in the world of health. My name is Vic Riches. Have yourself a wonderful holiday.
Èmi ò ní lè tún wálẹ̀ láyé.